Chairman McNamara, can you tell us a little bit about this joint legislative study commission that was formulated here in Rhode Island to take a look at the way nursing homes are doing business?
Dave, what we looked at was a change in nursing home culture. There have been several national initiatives that have developed models called either Eden or Green nursing homes. And the focus in these nursing homes is to put more of the emphasis on the consumer or the individual who's utilizing the services, and to develop more of a home-like community. Very small, 10 individuals with their own bathrooms, maybe a common living room, assistants for cooking and personal adult daily living needs. So a condition that's much more respectful of our seniors and their living situations that they are used to. The current model for most nursing homes is an institutional model that has specific times when the patients have to get up, a specific time for lunch. Their routine, the routine of the patients, fits into the model that the nursing home, or almost like a hospital model, that has been set up. The Green model or Eden model is more like an individual living at home with folks that are there to support them, both for clinical nursing needs as well as with adult daily living skills. And I saw this during the past decade and dealing with my own late mother, who was in an assisted living residence and then transitioned into a nursing home. Little things like bringing in her own bedroom and her bureau. And I realized the importance, even as folks age in their 80s and 90s, that other individuals and friendships have in enriching the quality of life. And having personally witnessed what that brings to an individual's lifestyle is very, very important and meaningful. And I believe it has health benefits as well. So for me, it's a very personal situation. I've seen how it enriches the quality of life for our seniors, and also realize that there's a tremendous therapeutic value in making some of these changes. And I had the privilege of working with Senator Levesque, who is a leader in this initiative, and I have to give him a tremendous amount of credit for the work that he has done, because we believe that this will ultimately transform nursing homes as we know them. And the value that's added through these smaller groups and the freedom that it gives the consumers and patients, I think can't be underrated. We have passed enabling legislation which will allow several nursing homes in Rhode Island to develop these smaller models where they may have 10 individuals, a small kitchen. They will have nursing assistants available to them and individual staff members that will assist the consumers or patients in their adult daily living needs. So we will see this enacted very shortly in many of our nursing homes that have expressed interest in this new model of nursing home living.
Here at this facility, you're using what you call a small house model. Tell our viewers how that will change the way you deal with residents who need nursing home care, and how it will change the environment and their lifestyle.
Well, currently our facility is set up so that our residents are in semi-private rooms with shared baths on long corridors. It's more of an institutional or medical model of care. And Senator Levesque's legislation is introducing a culture change model of care into Rhode Island. And our small house model, which we're proposing, is a model of care where we would have 12 to 16 residents, each in their own private bedroom and private bathroom, surrounding a living room, dining room, and kitchen. So there'll be much smaller, more intimate environments of care for these people. We currently practice primary care, which means that our residents have the same caregivers about 85% of the time. That will continue in the small house model. But being exposed to being able to use a living room, a dining room, a kitchen, being able to help out making meals, being able to go outside to courtyards right outside of their living room, it'll change their environment a lot. We're moving away from looking like a hospital. And we provide high levels of medical services in this environment. You know, we have the labs that come, we have pharmacists that are here, the physicians are in and out all of the time, we're doing rehab with our people. But what we need to remember is that we want our folks to feel like this is their home. You know, this is where they will be living, for many of them, for the rest of their lives. And so for them to be able to live here and feel comfortable, we want them to know that they're a person first, and their diagnoses and their healthcare needs are going to be taken care of, but that's not who they are. You know, we encourage our residents to do that now, to bring in whatever they can. But you know, when you're sharing a room with somebody else, a stranger that you've never met, and they've got some of their things, it's hard to make that room blend and feel all of your own. So in this environment, they'll be able to do that. They'll have their own space, that they'll have plenty of space to bring things in from home and to make it really theirs. And I would hope that they would feel comfortable enough to do that in the living room and the dining room as well. You know, maybe they have some pictures or vases or trinkets that they want to display, and they want to share them with their fellow housemates. We're an agency of the Catholic Diocese. There is one other nursing facility in the state, St. Antoine Residence, that's an agency of the diocese as well. We've been part of the diocese for, believe since 1925, when the Daughters of the Holy Spirit, which is the order of sisters that started St. Clare Home, asked the diocese to come in and take over operation of the home.
I have to believe that as you talk to your residents about this small house concept, I would think your residents would be thrilled about this change.
They're very excited. They're very excited. You know, we have probably 23 private rooms currently, so that's a lot more private rooms than many other nursing facilities have. And I have an internal waiting list of about 10 people that want a private room. So those folks are particularly excited about the possibility of being part of this proposal and getting to live in something that will more approximate the house that they're used to living in. It's about letting them age with grace and dignity, and valuing them for the people they are.
For you personally, what's the most rewarding aspect of this work for you?
When the people that live here come up to me and talk to me about how wonderful it is to be cared for and loved by people that they consider family in a place that